Hi, everyone. Gene Nichols back with you for another edition of Community Roundup. Thanks so much for tuning in. We're coming to you from the K News studios here at Alpha Media. And Dr. Jenna LeComte-Hinely is back with us, and she is with the Harc organization here in the Coachella Valley. We'll give you their website. We'll tell you what Harc does, what it stands for, and a whole lot more as we touch upon this issue of cervical cancer. Dr. Jenna, great to have you back.
Thank you so much for having me, Gene.
All right, let's talk a little bit about what Harc is and what it does.
Absolutely. So Harc is a nonprofit here in the Coachella Valley. It stands for Health Assessment and Research for Communities. And so what we do is gather data on all sorts of factors related to health, wellness, and quality of life. And then it's our job to give that data back to the community so that they can take it and use it and make great things happen.
All right, and when we're talking about certainly health, we're talking about a number of different assessments. We've talked about diabetes before. We've talked about suicide before. Now we're talking about cervical cancer and cervical health awareness. What should the ladies in our audience know?
One of the reasons why it is worth raising awareness is that it's almost entirely preventable cervical cancer. We have a great many very accurate tests that can screen for that, and as soon as you catch it, you have a much, much greater chance of actually curing it and of it not being fatal.
Is cervical cancer something as widespread as, say, breast cancer is among women?
About 12,000 women in the U.S. acquire cervical cancer each year, and of those, about 4,000 die from cervical cancer. Cervical cancer used to be the leading cause of cancer-related deaths among women, but that's no longer the case because we have these great screening and early detection procedures.
Still, if 4,000 perish out of 12,000 who come down with it, that's isn't that about roughly a third?
It is, and that's substantial.
Yeah, I would say so as well. Okay, how do we know we might have this? What do we sense? What do women have to look for? And are there preventative measures to take?
There absolutely are. So one of the best ways to screen is the Pap test, and that screens for cervical cancer and should be done beginning at age 21 for women and done annually as recommended by their doctor, sometimes less than annually if you have no history and have had some clean tests in the past. But it's very simple, it's covered by insurance, and it's something that should absolutely be part of your health routine each year.
We've heard of something called HPV, or human papilloma virus. How does that play a role, or does it with cervical cancer?
That's a really good question. So HPV can cause cervical cancer as well as vaginal and vulvar cancers. And what's really great is that these days we actually have a vaccine for HPV, which is relatively recently developed. And it's really targeted at young people before they're sexually active. They recommend that most children get it between the ages of 11 and 12, but it can be done as early as 9 or as late as 26.
Here in the Coachella Valley, obviously cervical cancer doesn't have anything to do with sun exposure like, say, skin cancer would. So what are some of the preventative measures that someone could take? Are there ways that one can improve one's lifestyle, weight, exercise, any kind of stuff like that as a prevention, or is it just simply getting early screenings?
Early screening is always great, but as you mentioned, a healthy lifestyle is associated with much greater good health outcomes and a reduced risk of getting cancers, all types of cancer. So while there's no way to certainly avoid it for sure if that's what's going to happen, you can definitely reduce your chances by eating well and exercising and, of course, getting that screening. And if you are in the target age range, below the age of 26, getting that HPV vaccination right away is very important.
Do we have any statistics on which age group might be impacted by cervical cancer more so than other age brackets?
Well, it typically targets women over 30 and older. Cancer is typically something that impacts our older population. And here in the Coachella Valley, we've had about 88% of adult women have received a Pap test at least once. And so that's a big plus. They have gotten screened at least once, although sometimes the frequency could certainly be improved upon.
Okay, when you say frequency improved upon, are we talking every year?
For some, the doctors recommend it every year. For others, they can go up to 5 years between. But it's important to make sure that it's a regular part so that you don't have cancer growing without you knowing.
Okay, these Pap tests, as they're called, are these something that are typically covered by a regular type of insurance?
Absolutely, yes. And so if you are insured, there's no reason to not get it. And if you aren't insured, there are places such as the Coachella Valley Volunteers in Medicine or Planned Parenthood where you can get a pap smear at no charge.
Give us a website or a phone number if folks want to contact Harc and learn more about something along these lines with cervical health or other issues as well.
Absolutely. Our website is harcdata.org. That's HARCDATA.org.
My guest has been Dr. Jenna LeComte-Hinely. She is with the Harc organization here in the Coachella Valley, Health Assessment and Research for Communities. And again, harcdata.org is the place to go for more information. We're going to also be talking to Dr. Jenna coming up very soon in subsequent weeks about the whole issue of heart disease here in the Coachella Valley. That's still to come. Dr. Jenna, great to have you with us as always.
Thank you so much, Gene.
I'm Gene Nichols. This is Community Roundup.